tobacco marketing to women. I have nothing to disclose, but I did want to acknowledge many of my co-authors, fellows, and collaborators on this work, as well as our funding from National Cancer Institute. I did want to call out two really good archives, the Trinkets and Trash Archives at Rutgers and the Stanford Research on the Impact of Tobacco Advertising Archive. These are both well-curated collections of free tobacco advertisements. So if you like my slides and you want to make some just like it, this is how you get the ads for free. There's also one image in this presentation that is done by AI, and I'll let you guys figure out which one that is. So I'm just going to keep talking while we get rid of the pictures. The learning objectives today are to really understand, give you an understanding about how and why tobacco companies sell cigarettes to women. Part of this is because we've been talking through the conference, right, saying we know the industry markets, but this presentation is intended to give you a little bit of an insight to how that works. We're going to identify 4 marketing tactics that appeal to women and that can exacerbate tobacco disparities. We're going to recognize, I'm going to show you how past tobacco marketing techniques now appear in contemporary advertising, and then we'll discuss some strategies to counter tobacco marketing appeals to support tobacco cessation. Click, click, click. Okay. So one might ask, why have a talk about tobacco marketing? The Surgeon General's report from 2012 already concluded that tobacco advertising and marketing causes young people to start and continue smoking. So we already know this. You might already also say, well, the famous women's branded cigarettes like Virginia Slims and Misty and Capri all have less than 1% of the market share now, right? So marketing to women is over. However, we know that with the advent of e-cigarettes, we've seen also a revival of many of the old techniques that were used to sell cigarettes in the past, including images of glamour, independence, and slimness. And while the body of evidence on e-cigarette advertising and youth initiation is still developing, there have been numerous longitudinal studies that have shown that advertisement exposure is significantly associated with e-cigarette initiation. We also know that youth continue to have high exposure to tobacco advertising. So analyses of the PATH data from as recently as 2019 still really consistently show that 60% of youth report current exposure to e-cigarette advertising. So it's also potentially useful to look at how the industry sells cigarettes because the tactics have had to change as the market changed, right? So back in the 40s, tobacco companies could take a sort of logical approach and say, you should smoke these cigarettes because they're good for you. Doctors smoke Camels. You can tell by your T-zone that these are better. Then over the decades, tobacco industry has really had to change techniques to get away from the kind of logical part of your brain and appeal to the other parts of your brain that, convince you to do something that is not good for you. So one source of insight about how that works comes from tobacco industry documents. So UCSF actually has the largest collection of previously secret tobacco industry documents. These were made public as a result of litigation. And we now have over 90 million pages of documents and with the website here. And I'm going to show you several documents in this presentation. That's when you see like the kind of poor quality image that's from the actual document. This is market research on the female smoker. The source of these are our website. So this is, you can look at the address, which is industrydocuments.ucsf.edu/tobacco, or you can just Google, industry documents UCSF, and you'll find the website. The tobacco industry actually has done a ton of research on women smokers, and not all of the questions are about brand image and smoking, right? A lot of market research is actually just about what's important to women. And this is an example from Philip Morris market research from the mid-90s. Asking about what's important to today's young women. And at that time, it was respect, independence, and family, which may not have changed much over the years. And these kinds of attitudes get put together with demographics to create targeted marketing. So this is called psychographics, where you kind of integrate attitudes, lifestyle, and social groups in addition to demographics to come up with subsegments of the market and then tailor campaigns. So this is an example of Philip Morris market segmentation research. This was a study done only on young adult 18 to 24-year-old female smokers. They did a national sample of over 1,000. They interviewed folks for over an hour and asked them lots of questions about their lives, their hopes and dreams, their friends, their activities. And then they use a segmentation analysis to divide young adult female smokers into 4 segments. Then the marketing folks give them cute names. So in this case, they called the 4 segments the 90s traditionalists, the uptown girls, the wallflowers, and the mavericks. And to give you an idea of what those are like. So the 90s traditionalists in this survey research, would agree more than the other 3 segments, which I've highlighted in red there. Statements like, I want to be a good parent, a good marriage is important to me. And they also have more contemporary ideas, so they're not afraid to disagree and state their mind. They're concerned about the environment and may like to start their own business. And they're also bargain hunters. So they're more likely than other segments to, look for a good bargain, buy stuff on sale, and look for good deals. Their social groups are more kind of down to earth people who are affectionate, self-assured, older, and maybe their family. And these are the brands that 90s traditionalists smoke. So you may notice that on the right, most of the brands they smoke are Marlboro and Marlboro line extensions. But what makes this segment different from the others is actually they disproportionately smoke what are called price value brands. So what's a price value brand? Well, Philip Morris had a brand called Basic, which is an example of a price value brand. It's a brand that really leans in to the idea of good value for the money. So the Basic smoking jacket is made from denim, not velvet. And the Basic night out implies just smoking with a partner. You can see there's lipstick on the cigarette on the right there. And so maybe the night out is a night in. And then the price value brands also come with additional discounts, like a free hat when you buy a pack of 3. And then, of course, buying increased volume encourages increased consumption. Even more than 10 years later, Basic continues to offer lots of coupons. This is a mailer for over $100 in coupons. Then if you save the UPC symbols off the pack, you can get prizes like a Zippo lighter or a set of horseshoes. And this tactic of saving money is still very present. We see today in e-cigarette advertising as well. We did a content analysis actually quite a few years ago now of e-cigarette websites and found that over 93% of the websites will have some kind of a cost savings as the reason to use e-cigarettes. This ad here, I guess from a while back, says that each e-cigarette has the nicotine of about 3 packs of cigarettes, right? With the current nicotine salt e-cigarettes, one device can have the nicotine of like over a carton of cigarettes. They're incredibly powerful. So, that could be phrased as like super cost saving. Just for contrast, a different segment of the market in this study was called Uptown Girls. You can see from the psychographics, they have a very different orientation. They're success oriented. They like to party and shop. They do value brand image. So this segment is not going to buy the cheap cigarettes. And they socialize with feminine, popular, cool, sophisticated people. And when you look at the brands that the Uptown Girls smoke, they disproportionately smoke Newport. So Newport advertising for decades and decades, right, has this portrayals of young people socializing together and having a great time and emphasizing the pleasure you get from smoking Newport cigarettes. So when we say that the female brands are going away, this has actually been true for quite a long time, right? This segmentation study by Marlboro shows that they knew that every segment, 3 out of 4 at least, Marlboro was actually the most popular brand among women. And so the female types of brands like Virginia Slims have always been a little bit lower. Awareness of this led Philip Morris in the 90s to say, we need to make sure the Marlboro man is accessible to women. They're not going to change the ad image completely, but they realized that the classic cowboy might be seen as kind of a loner. And since women are more socially oriented, the strategy was to make him a little bit more accessible, a smile, a touch, a tip of the hat. So you can see around this time, the advertising for Marlboro changed. The Marlboro man is smiling sometimes. The Marlboro man has a friend. And these small changes were designed to keep a masculine image, but make it a little more accessible and acceptable to female smokers of Marlboro. Similarly, promotions like the Marlboro Country Cookbook were also probably less likely to be made for men. So the big competition for Marlboro in the 90s was actually Camel. And this is Joe Camel, who was very masculine and really didn't have a kind of more feminine side. And up until 1998, when the Master Settlement Agreement prohibited cartoons, this was big competition for Marlboro. Now, Camel didn't soften Joe Camel. They had to get rid of Joe Camel. But to appeal to women, they took a different strategy, right? R.J. Reynolds introduced a whole different line of Camel cigarettes called Camel Number 9. This was introduced in 2007 with beautiful slim boxes with teal and pink trim. Number 9 was supposed to evoke Love Potion Number 9 or Chanel Number 5. And this is an example of advertising where on the left side, that whole fashion tips is also part of the ad, right? And so it looks like magazine content, but the color scheme, the shape of the 9, the look and feel is all tailored to complement the cigarette. In addition to quantitative research, segmentation research on women, tobacco companies also did a lot of qualitative research on women. This is an example of qualitative research done for Virginia Slims in the 90s, where again, the companies kind of played a game and had the women in the focus groups talk about things like the real me, friends and family, your stressors, the differences between men and women, fears and frustrations, romance, and balancing life and work. So again, very kind of deep interest in the lives of women. And then sometimes things they hear in the focus groups end up in the ads. So for instance, this is market research from Philip Morris that said women acknowledge they have female friends, and these are really special friendships. In addition, the others are long lasting. The Virginia Slims ad that reflects this sentiment is an example is here. If our best friend seems to know everything about us, it's because she does. Sometimes the focus groups are really used to test the appeal of advertising that's already been created. So this campaign shows women in fantasy escape settings with the slogan, "She's gone to Capri and she's not coming back." If you think about who this ad is for, at first glance, you might say this is for, rich women who are thinking about their vacation. But really, when you look at the market research, right, this ad was actually really designed for poor women, right? So this appeals particularly to women who are inundated with responsibilities and demands from their spouse, their children, their work and home. And they're especially apt to be drawn to this image of a woman alone, pleasuring herself. So again, this kind of imagery was designed to position the cigarette as a small, affordable pleasure, right? A moment for yourself and a small piece of luxury. And that's actually very appealing to low SES women. To follow up on some of the other tactics tobacco companies have used to target low-income women. I actually did a study on this with Lucy England, who did your keynote. And this is one example. R.J. Reynolds thought about packaging food stamps with cigarette coupons in the 70s. Back then, you used to get your food stamps in a manila envelope, and they just wanted to snuggle in a few coupons for cigarettes alongside the food stamps and distribute them with food stamp distribution. And then the cigarette coupons would be alongside coupons for Campbell's soup and other kinds of foods. This was a deliberate attempt to reach out to primarily what they called welfare mothers. And even though R.J. Reynolds' consultant did say, people might think this is unethical, this is a quote from the consultant that says, there may be some objections due to the moral or ethical problems of targeting poor people, inducing poor people to buy cigarettes with the little money they do have. Nonetheless, R.J. Reynolds did pursue this tactic, and it actually didn't totally go through because their contractor for distribution didn't do a good job, but that they still were very interested on African-American and Latino inner city targets. Here's some examples of African-American women, market research done by R.J. Reynolds. This is a study they did and characterized young adult African-American females. Very insulting here. They say that this target is a single parent. She's unemployed or on welfare. She lives with her mom or her sister. She uses her extra money to shop for clothes. They really use, again, images of luxury to appeal to women with little money. So this brand Ritz was developed with a crossover with Yves Saint Laurent, and they had sweepstakes for trips to Paris. They had giveaways of items that were appealing to women. When they tested this, they thought this was really going to work. It was a little too hoity-toity. So they then modified campaigns a little bit, still emphasizing luxury, alternative advertising, using things like beauty salons to do outreach, smaller packs because they're cheaper at retail, and then adding menthol to appeal to African-American women. Another theme that really tobacco companies have focused on in terms of appeals to women is social acceptability. So we wrote a whole paper about how the tobacco companies have tried and failed to produce socially acceptable cigarettes. These are mostly cigarettes that don't have any side stream smoke. And you might imagine that secondhand smoke is so easily to detect by non-smokers that even if we reduce it by 90% or 95%, people can still smell it. So for the most part, these products failed, but they did think these products would be great for women. And here's the market research that says, women more so than men have a lot of internalized guilt about their smoking, and smoke odor and the odor after effects dredge up the guilt. So women are going to be especially interested in smokeless cigarettes. RJ Reynolds actually invested a lot in trying to make a version of Salem that was smokeless. They called it Salem Pianissimo. They had to change the cigarette so much to make it smokeless that it failed in the US, like a really weird cigarette. But they did find that this product did okay in Japan, because in Japan, women in Japan, especially young women, they called hygiene fanatics, were actually very concerned about odors, smells, wash their hair twice a day. And so this market actually fit the smokeless cigarette. This is an example of the Salem Pianissimo. Now, Philip Morris was also working on a smokeless cigarette at this time. Again, in the early 90s, they had this cigarette called Accord. It's a modified cigarette. You put it in this little heater, and when you smoke it, it was supposed to have much less smoke around you. This may look familiar to you because, nowadays this has been made into the IQOS heated tobacco product, which, has been held up in litigation for the past, year plus here, but Philip Morris is ready, right? I think they just announced they're going to start marketing this again. And you can see this is kind of like when you look at movies from the 80s and 90s and you see the big giant old cell phone. And this is sort of the cell phone of today with smaller electronics, but the same idea of a modified cigarette and a heater. And you can see the marketing overseas uses these very fancy stores and imagery that appeals to women. Here's the IQOS Instagram page from Japan, where again, you can see that the product is paired with feminine accessories. They have flavors that may appeal to women, and settings such as a spa that are female targeted. The other aspect of marketing overseas that really emphasizes appeal to women is the use of menthol in flavors. So in Asian countries, menthol is really the marker of female cigarettes. And here's some market research from Japan, again, on Salem Pianissimo, where they talk about how, the menthol cigarettes are perceived to be lighter and consumed primarily by women, especially younger women and other beginning smokers. So while this is very, in the US, there's a little bit less of menthol means women, but in other countries, it's very much menthol is associated with female brands. What we have now, and as Dr. Davis mentioned yesterday, is that in addition to menthol and flavors and these coolants and flavors are really just proliferating and becoming more and more popular. So the Truth Initiative did recently a study and just asked about the use of concept flavors like iced mango and blue dream, and 3/4 of youth and young adult e-cigarette users are using these kind of concept and flavors that sort of put together a coolant with a fruit. So they're becoming very, very popular. Some of our qualitative research with young adult poly tobacco users had raised a kind of interesting thing, which is using flavored cigarettes for dieting. So this is actually one of our male participants, but who was talking about how they had this flavored e-cigarette that was pound cake flavored. And so he would use it for dieting. So after dinner, instead of having pound cake, he would be like, okay, it's time for dessert. He would vape the pound cake flavored e-cigarette. And we had another female participant who said, this is a tobacco product, and I'm vaping it and it tastes like dessert. It doesn't make sense. It's weird, but it's so delicious. And that's a problem. In addition to the nicotine vapes, the non-nicotine vapes are also getting in to the market here. My colleague Bonnie Halpern-Felsher did a survey in late 2021 that found, I think, 26% of respondents had ever used a non-nicotine e-cigarette. And about half of those had used one in the past week. So again, non-nicotine vapes, these originally came out several years ago, but you see them now. The most popular contents are THC, CBD, melatonin, caffeine, and essential oils. There's been some talk today of thinking about cannabis crossover, particularly as we eliminate flavored nicotine vapes. What we've seen is that flavored CBD vapes. So even if cannabis is not legal in your state, if you because CBD is made from hemp, right? It's not regulated in the same way. So these flavored CBD vapes basically have a market opportunity where we get rid of flavored nicotine. So these are all just pictures from the internet of flavored CBD vapes to be aware of. So in summary, the tobacco industry marketing to women is based on a really deep understanding of desires and motivations, and these range, right? So from savings and bargains and discounts to quiet moments or needing a respite from the stresses of life, images of luxury often used to appeal to those who are struggling financially. Products also use less odor or less social pressure, and maybe safer as an appeal to women who are concerned about their health. Flavors, especially menthol, signal that they're for women in some countries, and then the combination of coolants and ice flavors are appealing and continue to be widely available. And then we can see that these kinds of marketing techniques really translate easily to new tobacco and nicotine products, as well as non-nicotine products in cannabis. So the implications here, I think I've really been interested here today to hear about the interest in the financial incentive work. I think for that, not just for pregnant women, right, but these kind of novel methods to reach lower income women, like through the 211 helplines or through other channels, I think could kind of take advantage of, which was a nefarious technique by R.J. Reynolds to pair with the food stamps, but to really put financial incentives to women who really need the money could be quite powerful. I think in addition to this, as mentioned recently, minimum price laws, getting rid of coupons and discounts and keeping taxes and prices high on tobacco products will all be helpful around especially the lower income segments. I don't know if you tell people to get rid of their coupons or to delete the app when they're quitting smoking, but the apps really deliver a lot of coupons. And I definitely have folks who feel like it's like throwing away money to get rid of your coupons. It's very hard to get rid of them. And then finally, other things that we could do to counter the marketing is really addressing some of these core motivations. So as we're thinking about, we've already heard today about stress and mental health and how that motivates tobacco use. Affordable and attractive supports for mental health to counter cigarette smoking or other vaping are going to be important, especially for young people. Decreasing the social acceptability of all tobacco products will decrease use. And then raising maybe safety concerns, as mentioned yesterday, about aerosolized flavored chemicals. We should anticipate that the less regulated products are going to exploit policy loopholes and proliferate as soon as we implement policies. And then we need to be mindful and address tobacco and cannabis co-use, particularly co-vaping, as that's expanding rapidly. So that is all I have. Thank you very much. I'm just going to show a picture. That's nice. All right.
Okay, great. We're going to hold questions to the end of this session. So it gives me great pleasure to introduce Dr. Stephen Higgins, our esteemed host here. Dr. Higgins is director of the Vermont Center on Behavioral and Health at the UVM Larner College of Medicine. He's a distinguished professor and the Virginia H. Donaldson Endowed Professor of Translational Sciences in the departments of Psychiatry and Psychological Science. He's the PI of 5 NIH grants currently on the general topic of behavior and health, including a Tobacco Center of Regulatory Science, which we fondly call TCORS, and a Center of Biomedical Research Excellence, which we call COBRI. And His research centers around using the principles of behavioral pharmacology and behavioral economics to investigate ways of reducing tobacco and other substance use in vulnerable populations. He's held leadership positions in multiple national professional societies. He's authored over 400 scientific publications, and he's received numerous prestigious awards from in the field of substance use disorders. And welcome, Dr. Higgins, please.
Well, thanks for that nice introduction, Jennifer. And it's a pleasure to have a chance to talk to you about something that's great interest to me, which are the disparities in smoking among rural versus urban women of reproductive age. Yeah, go for it. So, in ways of acknowledgements, I have collaborators on the most recent study that I'll share with you today, Fang Chen and Tyler Erath, NIH grant support, and nothing beyond the grant support to declare. So U.S. rural health disparities have been a concern in the U.S. since 1980s. And on average, prevalence of risky health behaviors and worse health outcomes in the rural versus the urban regions, with good reason to infer that inadequate healthcare access is a notable contributor to these disparities. So when the seminal 1964 Surgeon General report came out on smoking and cancer, smoking prevalence was actually lower in rural than urban regions for both men and women. And smoking since that time has decreased considerably throughout the U.S. in both regions, but the rural areas now have greater prevalence. And my overarching aim in this presentation is to just give you a brief overview of the topic. But my great interest is among U.S. women of reproductive age. And for the first time, we're going to try and look at disparities in quit ratios in that population. But I'm going to take you through studies how we got there. And it was once upon a time I got involved with the T-Corps, and we got on to, I was leading a work group for the T-Corps on vulnerable populations. So Nate Dugan from the Ohio State T-Corps got us onto rurality, and we examined smoking in men and women across years 2007 through 14 using the National Survey on Drug Use and Health. All the studies I'll mention or I'll describe use that same survey. And we demonstrated an overall increase in disparity across years that was not fully accounted for by socio-demographic differences. And like demonstrating that you couldn't really account for the rural disparity by just accounting for the socio-demographic differences was our main interest when we went into that study. But then we got a little signal in that study that there was something going on with women, that the disparity was more about the women than the men. So Antonio Cepeda Benito led the next study, and we used the same years, the same survey, but we went after these gender differences and demonstrated them, and I'll show you the outcomes. And then in that same year, Tyler Nyber led a study, and the years are a little different still with NSDA, but we went out to 2016, and we demonstrated rural-urban disparities among women of reproductive age, including those who are not pregnant and those who are currently pregnant. And then most recently, Maria Parker with Andrea Valenti and Andrea Weinberger did a study for the first time looking at quit ratios and covered the years 2010 to 2020. And they demonstrated lower odds of quitting in rural versus urban adults, but they didn't look at gender differences, and they didn't look at the women of reproductive age, which I'm going to look at in this study. So the shared methods I already mentioned, we all use the National Survey on Drug Use and Health, and that survey includes people 12 and older, but we focus on adults and 18 years old and over. And we definition, so current smoking in the NSDAs, you smoked in the past 30 days and you've smoked more than 100 cigarettes lifetime. And I mentioned we focus on adults, and the rural urban, you can look at our papers. It's a little wonky, but there's a standard way that you define rural communities, and essentially they're the ones that aren't urban or micropolitan. So we follow that, which is pretty standardized. Then we present unadjusted and adjusted odds ratios and outcomes, and all the studies adjusted for race and ethnicity, education, and income. And depending on the focus, other covariates vary from study to study. Current smoking prevalence, I already mentioned. Former smoker status is they reported that they smoked 100 cigarettes lifetime, but not in the past year. And then the quit ratios are a proportion of lifetime smokers who report not currently smoking in the past year. All right, so Nate Dugan's study, and so this is the unadjusted prevalence data, and the green is showing prevalence rates for smoking in adults, males and females in the rural communities, and the I guess it's purple is in the urban communities. And you see two differences. One is that there's a disparity, the prevalence is higher in the rural communities, and then the slope in the urban community, that the smoking prevalence is going down at a more rapid rate in the urban than in the rural communities. And then I mentioned that the goal was to see, could you knock this out? So not only the socio-demographics, but everything they could think of, you know, are you married, or do you have health insurance? And we could not account fully for the disparity. And that's where you begin to make the inference that tobacco control and regulatory policies, differences in those two are probably accounting for some of this disparity. Okay, then we start to transition into being very interested in what's happening with women. And so what I'm showing here are the unadjusted. And if you look at the top, those dashed lines are the rural men, and the more the dots, well, I guess I should go to the rural women, are the dashes below the men, but they're flat. And then the urban men are the dots that overlap with the rural women, and then the urban women are the lowest on the graph. And then you can adjust, you know, for the potential confounders, but what you don't knock out is that flat line in the rural women. And so if you could look at them versus their urban counterparts, which is the lowest line, and the slant downward, that's the disparity we're dealing with. And I think Pamela's presentation gives you an idea of how the tobacco manufacturers take advantage of this and help to promote it. And it's very, very substantial disparity. Okay, so now I'm going to jump a little out of chronological order to get to this most recent study by Maria and Maria and Andrea Valenti were authors on many of the prior papers I just mentioned. And what they're doing here is examining, comparing rural and urban quit ratios. And what they show in the upper line is the urban men and women, and the bottom line is representing the rural. And long and short is the quit ratios are greater in the urban than the rural, and there's no interaction with time. It's just a main effect of more quitting in the urban than the rural areas for men and women. All right, so now on to Tyler Nyber. That was 2018. And we began looking at women of reproductive age. And so what we're showing here is just overall prevalence between 2007 and 2016 in 2-year bins. And the reason that we use the bins is when you get into the pregnant women, it's smaller ends and you start getting more variability. But this is not pregnant and pregnant women together, just all the women. And what you see is the same thing that you saw in some of the earlier studies. The top data points are the rural women, and the lower data points, the urban women. And so a difference in prevalence and a difference in slope. So prevalence is going down faster among the urban women than the rural women. And then what we're showing here is in the left panel, you're looking at rural not pregnant on the bottom and rural pregnant on the top. The flip of that. The rural not pregnant on the top, the rural pregnant on the bottom, and then on the right most panel, you have the same, but in the urban women. And what I want to draw your attention to are two things. One is you could see that the rates for not pregnant and pregnant women in the left-hand panel, the rural women, are greater than the right-hand panel by a lot. And then the other thing I want to point to is if you look at the urban women, there's this really nice open space between the pregnant and the not pregnant. And that means the pregnant women are quitting. I mean, their prevalence is lower and their counterparts who aren't pregnant currently are above them. And then if you look at the rural women, often they're sitting almost on top of each other, and they're just not quitting as much related to the pregnancy. All right, so now this is really the most recent study and where we wanted to get to, and it's still ongoing, but the analyses I think are pretty firm, and I wanted to share them with you. So we wanted to have a look at quit ratios for the first time. So still using NSDA, same definitions, and we're going to show you unadjusted and adjusted odds ratios. And when we adjust, we're talking about race, ethnicity, educational attainment, and annual income. And I think I've defined everything else already. So this is overall smoking prevalence, and much like, so we've compared to Nyber et al., we've started earlier, so 2002, and we went out further. So just getting a better characterization over time of this disparity. And you see the rural women on the top and the urban on the bottom, and you get that same overall difference in prevalence rate, and also a greater decreasing trend in the urban compared to the rural women, which is an interaction. So the odds ratios, unadjusted and adjusted, are shown in the bottom of the panel. And the very sizable 77% increase in smoking prevalence. The odds of being a smoker in the rural women versus the urban women And then you can adjust for those three socio-demographic characteristics and the race, ethnicity, income, educational attainment are each independently associated with smoking prevalence. You reduce the odds ratio difference quite a bit, but you don't eliminate it. But the important point here is that's for accounting and understanding the disparity. It doesn't adjusting for it doesn't eliminate the disparity. We still have these rural women, whether it's because they're poorer, less educated, or for some other reason, it's still the case that they're smoking at higher rates. And then when we separate them into those who are not currently pregnant and those who are, you get the not pregnant is almost identical to the overall because most of the women aren't currently pregnant. So I won't bother saying more about them. But the pregnant, what you get is the difference in the odds of being a smoker. You don't get a difference in the trends. So there's no interaction with time. And the pregnant women who live in rural areas simply are not quitting as much around a pregnancy as the urban women. So you can, for the first time, we've finally gotten into quit ratios and you see similar patterns. So now what you're going to see is the rural women are going to be below the urban women. They have lower quit ratios. And this is the overall population difference. And the interesting thing is that there's no interaction with time, and that's different from what I showed you with overall prevalence. So what I think that suggests to me, like my main interest here is the document. Is it the case that there's less quitting going on and we should do more? But it also tells you that that there's likely greater initiation of smoking going on in the rural settings as well. That accounts for that disparity in over time, where when I showed you prevalence, the smoking was going down faster in the urban than the rural communities. That's not accounted for by these quit ratios. All right, so you see the same thing with the pregnant and not pregnant and pregnant women. There are differences. The not pregnant looks just like the overall. The pregnant, there is just lower quit ratios in the rural compared to the urban, and they're quite sizable. If you look at the odds ratios, it's a serious problem, and Mark Levine mentioned it, so I think the policymakers are aware of it. And so in terms of this rural-urban disparity in cigarette smoking, it's robust and impactful, contributing to disparities in morbidity. It's quite striking. If just pick a chronic health condition and then see if there's a rural to urban disparity, and most of them come up. So definitely with cancer, cardiovascular disease, and mortality. And if you haven't seen it, the Washington Post is running a really impressive series the last couple of days on how chronic health conditions are undermining U.S. public health, population health. But when you dig into it, it's mostly what we're talking about here, mostly in the rural communities. So this disparity that I'm showing you is definitely disproportionately impacting women more than men who reside in rural settings, and impacting those of reproductive age, and includes, is likely contributing to disparities in infant health outcomes. So one, I just want to remind myself this morning, drinking coffee, waking up, can you find that disparity for SIDS? Yes, you can. So it's really unsettling what's going on with smoking among women of reproductive age in our rural communities, in rural and urban. It's just greater, in the rural areas. So And then where previously these differences could be accounted for completely by differences in socio-demographic, socioeconomic disparities, that's less the case more recently. And again, that doesn't, even if we could fully account for them, it doesn't obviate the need for action around the disparities. And I think the disparities in the availability and enforcement of tobacco control and tobacco regulation policies are likely contributors, and they're actionable. It's where we can make changes, and the differences shown here in quit ratios underscore the need for additional and more effective smoking cessation services. And I'm a little biased here, but especially for pregnant women who are currently undertreated. And Mark Levine showed the data from our work here in Vermont. And we have the intervention with financial incentives that produces six-fold greater outcomes. And the interesting thing is just how much slower the US is versus others. So that's already the UK, April of this year, announced they were going forward with national implementation. And as well as intention as we are, and I work with Mark Levine's team, we don't even have it in Vermont, where we did the first step, published the first study in 2004, but we're getting there. We're getting there. This one big hangup about adoption of contingency management for both treating smoking and among pregnant women. I agree with Pamela. We should be going after the not pregnant women as well, and many other populations, is we've been unable to get CMS, the Centers for Medicaid and Medicare, to reimburse for the incentives. And so these waivers are kind of getting the camel getting his nose in the tent. So California was first, and they got a waiver that allows them to use Medicaid funds when treating psychomotor stimulant use disorder. I could go off on that, but I'll stay on smoking. And then Washington State got the same waiver, but they just got it for substances more generally. And I think that's what we're going to try and get, I hope, in Vermont. And almost like as California goes, the rest of the US, I think, is going to go. So I really hats off to California for doing that. And Pamela could probably say more about it, but my understanding of that was the if you think it's bad for pregnant smokers, I mentioned 20 years. 30 years ago, we demonstrated that same incentive program for psychomotor stimulants here in Vermont. 1991 was our first paper. There is still no other treatment that is effective in randomized controlled trials. We have a national epidemic of psychomotor stimulant use now associated with fentanyl and overdose. And Governor Newsom, I think, essentially said to CMS, we're going forward with this with you or without you. I read between the lines at that. And CMS came around and they got the waiver. And then I think it's just a matter of time before we'll have waivers in many states. So I will stop there. Thank you.
Okay, we are perfectly on time. And so Dr. Ling's coming back. And I'm also fair game for this session for questions if anyone has any. But we have about 25 minutes set aside for Q&A.
And as the presenter, you're
That's what I mean.
Yeah, very good. Very good.
Take hot shots at me or
yeah.
Is this on? No. Okay.
Check.
Oh, we have a question.
Thanks for a great series of presentations there. My question's for you, Steve. It was nice to see all those papers in one presentation, the arc of the program of research. And I was struck by the quit ratios between rural and urban women. And I'm wondering if in any of those papers, or maybe this is something you plan to look at, if there's any indication of whether the lower quit ratio is due to a decreased likelihood to attempt to quit smoking among rural women, or lower success rate among
Right.
people who attempt, or
Okay.
maybe some combination of the
Yeah.
two?
Great question. I do not know the answer to that, but we have not finished this study, the one, and that's a great thing we could look at. So thanks for bringing it up, and I do not know the answer. I hope we could find the answer to it, but I don't know it right now.
Yeah, this question's for Dr. Tidey. So you gave two broad ways forward for a nicotine mandate. One of them was an all or nothing kind of national approach, and then the other one was this kind of state by state approach. Has there been any research looking at the impact of a state by state approach in terms of, let's say, like interstate smuggling or opening up of those kind of black market channels?
Yeah, actually, I didn't talk about a state by state approach. I think it was Dr. Levine who talked about that. I
That's
think
my mistake.
that if you were to go in that way, that would definitely be a problem. Because it's already a concern as a national policy that there might be, illegal, as we call black market or illicit markets for higher nicotine cigarettes. So I think a state by state approach would just be, I can't imagine how that would work very well.
That's my mistake that you were jogging my
Yeah,
memory. Thank you
that's
for your
okay.
input.
I actually have a question for Dr. Ling. It struck me that using the tactics of tobacco companies against them to try to entice women into smoking cessation treatment, it would be a really fruitful direction. Are people doing that using, tailored advertising campaigns or something to entice women?
Yeah, I mean, I think the principle of social marketing, right, which is to use commercial marketing techniques for public health good, has been around for decades. I think the level of sophistication that the tobacco companies do and the kind of really detailed targeting is less. Usually the public health budgets are like 10% or 1% of what the tobacco industry has to work with. But I do think just taking some of the principles though could be wider, just like we were thinking about financial incentives. It's like, if my mom will drive across town to use a $2 coupon, right?
Mhm.
Like very, very price motivated. And there probably is a subsegment of women who would really respond to financial incentives to quit smoking. And maybe it's not like a universal thing, but saying like, how can we reach, the women who would really, that would be very effective for them because of their price motivation. So I think there may be ways to kind of use our funds, limited funds, in a smart way to do really targeted outreach based on motivations.
Oh, good. So I guess I'll throw that to Steve. Is anybody doing that, or have you thought about that, trying to tailor incentives to particular subgroups?
I have not really thought about it. So I'll put that with Eli's observation, although Eli's a little easier one, I think, to answer. But I think trying to learn from the tobacco manufacturers is a good idea, even though they put all their smarts towards very what you might think evil outcomes, even though their motivation, I think, is money, but the outcomes are horrendous. But they're brilliant, and they're usually a decade or two ahead of us in thinking through things. And the reason is they have the money to put towards the kinds of detailed studies that Pam was sharing with us. I think money is pretty fundamental.
Yep.
And that's why we use it. In behavioral science parlance, it's a general reinforcer. If I go with specific, like, sports tickets or fragrances or whatever, you'll get some of the population, won't get the other segments of the population. But most of us respond to financial incentives. And so even when we weren't using cash, we use vouchers. We within ethical boundaries, we try and let the participant tell us what's rewarding for them. So that's the tricky part of it, I think, is, but I guess I should say, that's not to, not to sound negative about the idea. I think the idea is a great one, and, we would just need to study how to do it.
Yeah, communications. Yes.
I had a couple comments and a question. Dr. Ling, I just loved I don't have a question. I just wanted to say I loved your presentation, and it was just fascinating from start to finish. Steve, I appreciate you bringing up Maria Parker's paper.
Yeah.
And I was trying to go back in my memory to see if we looked at gender. We definitely didn't report gender because it was published as a brief report.
As a letter, yeah, I thought.
As a letter
Yeah.
in JAMA, and it was the tiniest word count I've ever seen. And I just checked with Maria, and she couldn't remember off the top of her head, but I'm going to go back
I'm
and look
sympathetic to
and
the
see.
letter and the word constraints.
I feel like we may have looked at it, and I'll have to look back and
Yeah,
see
I
what
would
we
think we
found.
probably did. Yeah.
And then, Jen, my question's for you.
Okay.
So when you talked about the studies for very low nicotine, there was the one that combined with nicotine patch.
Yep.
And that was the only one that had the combined treatment. So I was wondering what your thoughts are about combining the very low nicotine cigarettes with other treatments or things like e-cigarettes and harm reduction products.
Yeah, so we're actually currently finishing up a large trial. Again, this is a University of Vermont T-course trial in 3 disadvantaged populations. And so the backdrop for that is that when the FDA announced its new nicotine strategy back in 2017, there were 2 prongs to it. There was reduce the nicotine content of cigarettes, the most deadly tobacco products, to render them less addictive. But the second prong was to try to shift people who are unable or not quite ready right now to quit smoking, to try to shift them to lower harm products. And then you could imagine that these 2 things working together could really move people off of cigarettes. And then hopefully they would also down the line move off of the other products as well. So the studies I presented were largely on the first prong, reduce the nicotine content of cigarettes. But what happens when you put these 2 things together? So the current study that we're just finishing up, which is 3 parallel clinical trials in the 3 disadvantaged populations that I mentioned earlier, socioeconomically disadvantaged women of childbearing age, adults with opioid use disorders, adults with affective disorders, meaning depression or anxiety disorders. That trial is looking at what are effects of VLN, very low nicotine content cigarettes alone, and combined with having access to electronic cigarettes, including one condition where they have access to just tobacco flavored, and one condition where they have access to a flavor of their choice, a preferred flavor. So I guess we'd just say stay tuned, because that we're literally finishing up the last 10 people or so in those trials, and then I imagine we will be writing it up this spring, and hopefully it'll be out there this time next year. So thank you for the question.
One quick comment in response to your question, Jen, about incentivizing treatment engagement. Just want to give a shout out to Vermont Department of Health, who has started doing that with the Quit line for pregnant women to incentivize engagement, not necessarily smoking outcomes, but yeah, important one.
Oh, that's great. Yeah, it seems like a great partnership you guys have, UVM and the Department of Health.
I have a question for Dr. Ling about the advertising, and you demonstrated some industry images of combustible products and e-cigarettes, but do you know of specific differences that tobacco companies use to advertise alternative nicotine products versus cigarettes differently? So like e-cigarettes specifically, are there big differences in the way they advertise them?
So the companies are a little bit, we do know that, right? Like almost all the cigarette companies do have an e-cigarette
Yeah.
subsidiary now. I think when you look at the messaging, the one different thing is that now some of the e-cigarettes can lean in a bit on this sort of harm reduction, right? And on this kind of reduced harm positioning, which for cigarette advertising for a long time, the tobacco companies didn't want to say a cigarette was safer because that would mean they had to admit the cigarettes were dangerous. So they just kind of skated around it. But I do think with some of the new products, you see more overt sort of positioning as this is a lot safer than smoking. It has fewer chemicals. They often can't make direct health claims, but a lot more leading in on indirect health claims is probably the biggest difference you'll see from old classic cigarette from more recent cigarette advertising.
I was also thinking kind of in addition to that, as you mentioned, all the tobacco companies have an e-cigarette subsidiary, but there are also so many little e-cigarette companies that exist. Just wondering how those ads might differ from each other, how their marketing tactics might differ.
Yeah, I think that what we're seeing now, let's say with young people and the disposable vapes, right? A lot of those are just other companies, right?
Yeah.
And so definitely when you look at the advertising from, like Philip Morris or RJ Reynolds, because those companies have been scrutinized and they've had lawsuits and and you can focus on them, their advertising is often much more conservative, right? But the most kind of like aggressive, crazy sort of creative and aggressive advertising will come from these small companies that have new products. And then as was mentioned yesterday, the products, the market evolves so quickly that by the time we get all exercised about Puff Bar, then it's being replaced by Flume and Elf Bar. So and also those small companies I think are very difficult, much more difficult to kind of the FDA is sending a bunch of warning letters.
Yeah.
And then they send some more warning letters, and maybe there'll be fines. But I think that is quite the enforcement piece is quite difficult with the small new companies.
Awesome. Thank you.
Pam, I have a question for you. You had mentioned about the heat not burn kind of being on hold in the US for some reason, and now that seems to be loosening. But I've been curious why it was on hold. Can you say anything?
Yeah, there was a patent dispute. So there was a lawsuit, I think, between RJ Reynolds and Philip Morris saying that it was some kind of patent violation. So that the lawsuit hung things up after Philip Morris had gotten the MRTP. But I think that was for import, and Philip Morris is now going to manufacture the heated tobacco here. And people were just emailing me announcements yesterday about how they've announced they're going to start upselling
I've
IQOS
been
again.
curious.
Yeah.
What
Yeah.
was going on? Thank you.
Hello. I think I'm a bit tall for this, so we'll make it work. This is a question for Dr. Tidey regarding the study. It's been mentioned already with the VLNCCs, the very low nicotine content cigarettes, and paired with the nicotine patch, the NRT. One of the things we've noticed at UVM when it comes to recruitment is we have a lot of participants on the recruitment side who are really nervous about the concept of VLNCCs. And I've also had a lot of people who we mentioned that we're investigating, what happens when people are smoking them, and then the response is, well, I know what happens. I'm just going to smoke more. And I'm like, well, we don't really know that. But there are a lot of people who I think the concept of it makes them nervous, and they'll express that to us. So this is looking considerably down the line. But if we're getting to a point where we're talking about introducing these to the marketplace, or even, which I think would be most of our preference, completely replacing the current cigarettes with higher nicotine content with VLNCCs, do you think there might be a role for an increased prevalence or availability or offerings of nicotine replacement therapy in combination with the VLNCCs to soothe the concerns of some people who feel like they're not going to be able to manage on VLNCCs? Or even if we were to do that, would that create problems with eventually, hopefully, getting people off of cigarettes?
Yeah, thank you for that question. There's so many things that went through my mind when you were asking that question. One is that when you, every once in a while, like the New York Times will run a piece on nicotine reduction. And if you read the comments to those pieces, one of the first things and one of the most frequent things that comes up is, what are these people, stupid? Don't they know that everyone's just going to smoke more? So there certainly is that perception that people will compensate by smoking more cigarettes. And it seems like the general public will think like this is a crazy idea. So there is a huge need to get out in front of that. And study after study shows there is no compensation. Whether you look at cigarettes per day, whether you look at nicotine exposure, or you look at tobacco toxicant exposure, or any kind of way you want to measure it, there is just no topography. They don't take stronger puffs, they don't take longer puffs. There is no evidence of compensatory smoking with very low nicotine content cigarettes. So that's going to there's going to have to be a communications campaign that comes out. If and when, let's say when the FDA moves forward with this policy, let's be optimistic and say when. The other thing is that people don't, and this misperception is growing over time. People think that nicotine causes cancer in cigarettes. So that's a huge misperception. So there's also concern. We say, oh, the FDA is going to reduce the nicotine content in cigarettes. Well, will people think, oh, these are going to be safer, and I can just keep smoking a pack a day of these VLNC cigarettes. So there's going to be a need for that kind of campaign, and also just a general communications campaign around what we call the continuum of risk for tobacco products. And we don't know where some of these products lie, but we know cigarettes are the worst, and breathing clean air is the best, and NRT is, down there, because we know, decades of NRT studies, nicotine in that form is safe, and some of these other products we don't know, but they're likely to not be as dangerous as cigarettes. So getting that messaging out is hugely important. And then also there's this general need for research on VLNCs as a smoking cessation tool, which I think you were alluding to with your question. And so we've been limited with that with our funding from the FDA, because we can't study total cessation of all products. We can study switching, but we cannot use Center for Tobacco Product funding to do a smoking cessation study. So there's some work being done using other NIH funding that is, I shouldn't say it's being done. Work has been proposed to look at can VLNCs be used as a smoking cessation approach, probably in combination with medicinal nicotine replacement. Yeah, so I'm hoping that work will be funded and then go forward, sometime in the next few years. Thank you.
I have a question for Dr. Higgins. I was looking at your financial incentives work, and I think you had people with financial incentives report lower cravings.
Oh, yeah.
For cigarettes. What is the mechanism for that?
I don't know exactly what the mechanism is, but it's highly reliable. We had it in all of our cocaine trials, and I think it almost creates a condition. So if we put financial incentives aside, if you put smokers in an environment in which cigarettes simply aren't available, craving is less. So I think it almost creates a psychological space where they have a commitment to not smoking and the craving decreases. So that's my best guess, but it is a highly consistent outcome.
I think you see that in hospitals too. People don't report craving
Maybe
because
even
they know,
better.
they know they can't.
They can't smoke. So it's an interesting phenomenon, just psychologically. Yeah. If the access to that reinforcer is not available, craving seems to go down. Jennifer just gave a great example. So it must be the case that you make a commitment in these incentive conditions, then craving decreases. I remember talking to Alan Leshner about it with regard to cocaine, and it kind of casts a different light on craving than how we often think about it. Almost something that's driving the use. But Yeah, I think it's a great question, and I'm not sure exactly how you would experimentally analyze to put your finger on it. But I think it was in our most recent paper, maybe that's where you saw it, with pregnant women. I underscored it because people assume that if you're incentivizing women not to smoke, then they're going to be experiencing, but potentially untoward levels of craving and discomfort, but that's not the experience.
Actually, I have a question for you, Steve, too. So you showed us that persistent tobacco use in rural women remains after you parse out other risk factors like education level, poverty.
Yeah.
You know, they reduce some of the variance, but you still see a difference. But so that leads you to think, well, there's tobacco control policies are less effective for rural women. And do you have any idea what those might be? What
I think one of the big ones, I think, is just lack of availability. You know, that there's no, I mean, you have the quit line, so you could, you know, that they should be available, but yeah, that would be, and then I think lower enforcement of policies about, you know, where you can advertise, where you can, you know, how you can sell, to whom you can sell. I just think all of that is less in rural communities. Rhonda may know, empirically with the health department. Yeah.
Yeah, and I think that's an excellent point. When you look at the density of tobacco retailers, I think that per capita, rural populations may have more exposure. We know like 95% of marketing by the tobacco industry is within the retail environment. And that's often, I think, something that we underestimate in our control policy. So we're looking at what tactics could we use to reduce the number of retailers. And I think Massachusetts has done some nice work in that arena. We don't yet have a state commitment to that because it impacts at least perceived economic viability. However, tactics might include increasing the price of the license. In Vermont, we have free tobacco license if you have an alcohol license. And as we know from the pandemic, is that alcohol licenses have increased considerably. So in Vermont, that means we have the potential for increase in tobacco licenses. And that in Vermont, with Dr. Levine, we work to get everything behind the counter as another tactic, but the industry held out and said, let's leave e-cigarettes on the counter. And so we got the rest of the tobacco products, but not e-cigarettes. So we're very interested in that space of reducing retailers overall. But I also wanted to mention that the CDC worked with all the states to provide comments to the FDA on the proposed flavor restriction for cigarettes and for cigars, but not including e-cigarettes. And CDC just really carefully maneuvered that because we are instructed, you know, we have lobbying restrictions. But if you put the evidence forward, which Vermont did, and other states, is that we can set up this unintentional consequence of shifting to other products. And so I wanted to mention that in terms of, and what you mentioned around the FDA, what it funds, what it's funding for a nicotine standard, and what you're allowed to do, is just that if I'm concerned that if we set a nicotine standard, which I find very convincing, a low nicotine standard, but that it's inclusive of all products. When I went to Garcia's tobacco shop, for example, just down the street from the health department, and Garcia's salesperson says, there just shouldn't be 6% nicotine content available Like, I don't like selling it because I know what that can do. And yet it's there, visible and very accessible. So I just wanted to ask you what you've heard, all three of you, around parity in establishing a low nicotine standard among all tobacco products so that we don't set up unintended switching to high nicotine levels in other products.
Yeah, I think it's an interesting question and really needs more research. So, for me, because I mean, there's like, are you really concerned about youth? Are you really concerned about adults? Hopefully we're all concerned about everybody. But I worry that focus on one group sort of leads to negative consequences for another group. And you've just given a great example of how that could happen. So for getting people to quit using cigarettes, we would want low nicotine cigarettes and then maybe higher nicotine e-cigs still available so that we shift them. We want those products still to be appealing to people who smoke, so that they're not seeking out maybe illicit sources of higher nicotine cigarettes. But we don't want youth to have access to those cigarettes. It's a very tricky balance that we're trying to achieve. Totally agree with that.
Yeah, we're not good at nuance.
Yeah, we're not good at nuance.
But that's what I think the science would suggest, that, the evidence is just abundantly clear that combustion is the big killer. And so people prefer combusted nicotine. But if we could take the nicotine in combusted products real low, leave it higher in non-combusted products, one of the consequences would be greater likelihood of quitting the combusted products. And for those who are unable or unwilling to quit nicotine completely, they would find the non-combusted products more appealing because of the higher nicotine levels. But that assumes that we're effective at keeping all these products out of the hands of children and youth. And so, that's the challenge. Same thing with flavors. I think it would be better in terms of helping adult cigarette smokers quit cigarettes if we had flavored e-cigarettes available as an alternative, but youth like flavors as well. So then,
Yeah.
it's a challenge. One of the things I wanted to mention is the Pamela talked about it, others had talked about it earlier in the conference, these coupons and discounts. The tobacco manufacturers spend $1 million an hour on marketing. Just think about it. $1 million in the US, $1 million an hour on marketing. 85% of that goes to coupons and discounts. So I don't know about how much rural women are targeted, but I know economically disadvantaged women are targeted, so it must be rural women as well, or they're a target. And the reason the financial incentives work is that they're the same processes that contribute to smoking vulnerability can make a small financial incentive more appealing than you might think it would be upfront. And so they understand that, and they just leverage the heck out of it. And I really hadn't thought about it in the terms that Pamela suggested, but some thrifty person like, oh, I can't waste this coupon, and and I wouldn't be surprised if they're thinking about how they outcompete financial incentives that we offer. They seem to be out in front of everything. Not that we shouldn't keep trying, but I think it's the relative values, and it's complicated. We have an adversary that's very sophisticated. So,
Yeah, I wanted to weigh in a little bit. I do think that there's a place for a limit of nicotine on maybe we just were here, but on the non-combustible products, just in part because if you look at who's using e-cigarettes, right, it's overwhelmingly youth. And the way they're distributed and marketed, again, if they're in every convenience store, They're very accessible to youth. There could be a way potentially to have high nicotine attractive e-cigarettes available, maybe by prescription, again, to think about, to really target that small segment of, smokers who cannot quit. But I think the widespread distribution, especially in in retailers, that are frequented by young people, leads to the kind of distribution of use that really favors the young. And even those who really believe that high nicotine e-cigarettes might be useful for cessation will admit to me that, there's really no need for like, nicotine pouches that have 50 milligrams, per gram of nicotine in them, or 10,000 puff 5%, vapes, which you can buy for less than $20. They're just in the whole kind of market trend towards increasing concentration and increasing size in thousands of flavors is probably, gonna appeal more to young people than hardcore smokers. And I think we're way off in terms of where we are in terms of that regulation.
Yeah, I don't think we disagree, because I think the UK sets a great example of being able to limit nicotine levels and still have them appealing enough to adults who want to move to e-cigarettes instead of combusted cigarettes. So I would agree with some limits, and we have a great model. That's what I think then.
Okay, we're actually over time, but if you have one question.
I
quick
have one question, just thinking about the rural issue, wondering if there's data or research that shows or talks about how rural folk interact with the healthcare industry maybe differently, or how differences in between rural providers and urban providers and how those might interact.
I wish I was more expert on all these things in rurality, but I'm not. But I think one thing as a starter, just fewer rural providers. And so I think that's our keynote speaker made mention of that. Someone, if I'm remembering correctly, let's start by, providing healthcare. And I think the rural populations, I live in a rural community, and, there's a pretty good drive to get access to healthcare.
Do we have time for one more question online?
It's remote. Yeah, I want to do that.
So Donald Shepard wanted to ask about the risk of an unintended adverse consequence. If a price floor were set for tobacco products that would make them even more profitable for retailers, one would expect them to engage in other forms of marketing through displays.
Do
you want me to repeat that?
Yeah, please.
Yeah. So from Donald Shepard, I wanted to ask about the risk of an unintended adverse consequence. If a price floor were set for tobacco products that would make them even more profitable for retailers, one would expect them to engage in other forms of marketing through displays.
Oh, so floor
potentially
prices would preserve profitability, I think is the unintended consequence.
I think it's a good point. I think all involved are influenced by the economic factors.
Yes, that's good. All right. Thank you all very much.